today we have Melanie with ExercisABILITIES talking to us about her business. Welcome, Melanie.
Thank you. Hi.
Thank you for taking this opportunity to help students. Can you tell us about your business and how you got started?
Yeah, absolutely. So my business is called ExercisABILITIES, and we're in Rochester. And it is a physical therapy, occupational therapy, speech therapy, so physical rehabilitation, and then medical fitness facility. So we have part of our team does health and recreation for individuals with adaptive needs. How I got started was I am a physical therapist by background. So, I mean, way back, I thought I wanted to maybe go into medicine and be a physician, but then kind of got learning about it and wasn't sure I wanted to commit all the training and the time and the money. And then once I had a family, be that committed to a job. And so I started researching and really found that physical therapy was something that would fit both my need to want to work with people in healthcare, but also my future goals of family and work-life balance and things. So I was a physical therapist for many years at Mayo Clinic, and I worked in acute rehabilitation and became a specialist in neurologic disorders. Spinal cord injury, stroke, multiple sclerosis, Parkinson's, those type of disorders. And just really, as I progressed through my career, found that there was this need for ongoing health and wellness that was therapeutic based. So we would be able to see people for a while in physical therapy, but eventually insurance would stop paying for the services. And it was usually well before we were ready to be done. Well before the person had met their goals, well before they were done benefiting from us. But we still had to discharge them and just send them off with a home program that we usually found and knew going into it they wouldn't be successful at because they really still needed help. They needed therapeutic help. So I decided to start a company. And about 2010, I started creating a business plan, and that has come to fruition today. Today we are a robust, long-term community health and wellness facility, and I have 30 employees now. And I just started with one in 2010.
Wow, that is quite an accomplishment. So talk a little bit about physical therapy. You mentioned that you didn't do the doctor route because it was a little more robust. So how long was your education and where did you get that education?
Yeah, so nowadays to be a physical therapist, most schools actually are doctorate level. So most schools, you go to your bachelor and then you apply to postgraduate school, which is the physical therapy school. And so you get your bachelor and then you get your doctorate. So you don't have to go get your master's degree as well. It's a post-training school where you get your doctorate, very similar to like dentistry or chiropractics. When I went to school, there was a lot of options. Most of the schools were master's level schools. And so the school that I picked was the College of St. Scholastica in Duluth. And then I did my undergraduate there. And at the time it was a 3+3 program where I was able to apply when I was a junior to PT school, got accepted. And then as a senior, I started PT school. So I was done in 6 years. That worked out really well. I graduated with my master's degree. Eventually they developed, because all the schools transitioned to the doctoral level, they developed a transition program, which I did take in 2008 and 2009. And so what that was we could take 6 additional courses and then graduate with a doctorate of physical therapy. And so I did that in 2009, or 2008, I guess, graduated with a doctor of physical therapy. So that officially I have my doctorate.
Very cool. Lots of dedication.
Thank you.
Yeah. So what got you interested in that pathway as you were young and just starting out? What drove you to that career?
Yeah, so I was somebody who was pretty career driven, and at the high school, even in middle school and high school, I wanted to figure out what I was going to do with my life. And so I knew just that I had a drive that I wanted to do something in healthcare. I think I was one of those kids that had an inkling that I wanted to help take care of people and make their lives better. And so I joined the Mayo Clinic Explorer program, which they actually still have today. It's a really nice program for high school students to be able to go and learn about different careers in healthcare. I think it's an evening program still. And I know my daughter could have signed up for it last year in high school. So I highly recommend that. When I went through that program quite a long time ago, it opened the doors to so many different careers. I was able to look at radiology and occupational therapy and nursing. And when I went to the presentation by the physical therapist, it just really struck me that that's what I wanted to do. I wanted to work with people. I wanted to be busy and hands-on. I really liked movement. I liked exercise. I liked the idea of helping somebody who couldn't walk again. That really, was something that I wanted to do. And it wasn't typically, a lot of people go into physical therapy because of sports. I did do sports in high school, but that wasn't why I went. I really always wanted to be a rehabilitation specialist, and so work with individuals with illnesses and things like stroke and spinal cord injury. So right from the beginning, that just really drew me when I was in that Explorer group. So highly recommend going to things like that, where you can really talk to individuals that are actually in the career, that they can show you maybe in person or by video, doing observations of things that you might want to do. Here at ExercisABILITIES, we allow high school students to come in and do 1 day or half week or full week experiences where they just observe and shadow the therapist. And so those are kinds of things that I really encourage people to do. And those are things that I did. And that is why I ended up applying to physical therapy school.
Yes, thank you. That was a very nice description of how you got started. For education, what skills did you need in high school that led into college that you needed? Problem solving, thinking, math. What skills did you need or would need to go into this field?
Yeah, so independent decision making and confidence in decision making, because we are in charge of some really important things which people really trust us to make good decisions on. That is a skill that's very important. Being attention to detail. You really are constantly having to make clinical decisions, we call them, a clinical decision making on just a minute by minute during a treatment session. You might start out a session thinking you're going to do one thing. By the end of this session, the patient's response has totally taken you in a totally different direction. And so you really have to have good assessment skills, critical thinking, and just basic confidence in your knowledge of the human body movement, in our particular area. And so those are some skills that are really good. I think leadership as well. I think pretty much every physical therapist finds themselves in a leadership position, because we supervise a lot of different individuals within our team. And so we have therapy technicians, we have therapy assistants, we have front desk staff, and we are the manager of our care plan and our patients. And so we get to delegate a lot of time. We get to delegate parts of the treatment. We get to delegate how we want people scheduled. We get to communicate we get to educate the caregivers. And so we are in charge of a lot. And so I know for me during high school and college, I was involved in student government. Did a lot with helping the schools and the leadership of the schools. That was something that was really a great experience and really helped me, was leadership.
Thank you. And I appreciate you talking about the various jobs in that facility, because I think as students are starting to explore, maybe physical therapist is down the road and maybe they'd like to start somewhere earlier. So I appreciate you talking about the differences in those jobs.
Yes.
So going with that, would you say there's room for advancement and growth in your profession, growing from an assistant to a tech? And would you say in the market that you serve, it's highly competitive, or do you have a big area to serve?
Yeah, when I come in and speak to students about career path for physical therapy, I do always like to talk about that. I think most people, all they hear about is physical therapists. And so they automatically think they want to be a physical therapist. The reality is that it takes a lot of schooling and a lot of financial funding to become a physical therapist, and it might not be right for every person. And there are different levels of jobs and different schooling that goes with each of those that might be more appropriate and well suited to where you're at. And you can start at one level and then you can go back to school and you can grow. So the answer is yes. Physical therapy technicians is that entry-level position. And physical therapy technicians, actually, it depends on the clinic, but most of the time they need a, usually like a 2-year degree or a 4-year degree, bachelor, really in any area like exercise or human movement science, kinesiology, things like that. And it can be a really great entry-level position for individuals want to learn more about the field, but also during those gap years between college, bachelor, and then applying to physical therapy school. Interestingly, a lot of individuals that I've hired through the years, sometimes they decide that they don't want to go to physical therapy school once they're a technician for a year or two during their gap year. Gap years are pretty common these days. We didn't used to do that, but it's very common. And I have had several technicians that have come in saying, I'm going to apply to PT school. And at the end of it, they actually end up maybe applying to physical therapy assistant school, or going back to school to get their master's in athletic training or their master's in exercise physiology, because those are other positions that we actually also hire within our company, athletic trainers and exercise physiologists. So there's a lot of variety that sometimes you don't know until you get that entry-level job. Physical therapy assistant is a really great place also that requires a 2+2, so usually 2-year technical school and then a 2-year professional training. There's several schools here in the state of Minnesota for that. And a lot of times physical therapy assistants come out, they work for a few years and they end up deciding to apply to physical therapy school. Or not. I mean, it is a career as well, that they can stay in that career lifelong. So yeah, there's a lot of growth, and I think the pressure to go straight into physical therapy school, it's very competitive. It's very difficult. Talking about the competitiveness, I always recommend people have a plan B that they're happy with, because I've also worked with several students who didn't get into PT school, even though I felt like they were great candidates and they were great rehab techs or they were great personal trainers that we worked with, but they just weren't able to get in because it's highly competitive. And so having that backup plan, I do a lot of counseling with our employees to help them figure out, so what's plan B? You've tried for 3 years to get into PT school and you haven't made it in. You know what? That's not the only career out there. Let's talk about what else you can do. So having that plan B is really important with, I think, a lot of the graduate programs in healthcare.
Yeah, it sounds like you're a great supervisor and boss to encourage that. If I were a junior and gonna maybe look at starting with you to try it and see if I like it, what kind of starting pay might I start at? Is there a ballpark number you could give?
So, we hire currently for our technician role, you have to have a minimum of a 2-year associate's degree, or a 4-year degree, 4-year degree even for our technicians, because it is, again, it's a highly competitive job that a lot of people really want during their gap year, and we can have people on board that already have that bachelor degree and maybe kinesiology or exercise science. So they actually get to do work with patients. So that's our entry-level position. Our pay range for that is around, right now, around $16 an hour for that technician role. Again, even with that 4-year degree under their belt. Physical therapy assistants typically make around $25 to $28 an hour. And then physical therapists can range anywhere from $35 an hour entry level up to, a experienced therapist up to $45, $48 an hour.
Wow, thank you.
Mm-hmm.
So I'm glad you clarified that. So if I were a junior in high school and I have a year left and I were interested in going down this road, what high school classes should I take that you would recommend?
Sure. Yeah. So in high school, I think just making sure that you're meeting all your requirements for sciences and making sure that you don't have just the 3-year, but the 4 years of sciences is really important. And so going all the way through physics. Physics is a really important piece that you'll take a lot of in getting your bachelor degree, as well as while in PT school. We do a lot with movement, and physics is really important with that. So any biology that you can take, if something like embryology is offered, or anatomy, physiology, getting those under your belt in high school is really great, because that'll give you a leg up, because it's extremely important that you get A's in bachelor, during your bachelor degree programming. And so if you take those classes in high school, you will repeat them again, but you'll already have a leg up above everyone else, and you can really strive to get those A's, because it is so competitive to get into physical therapy school that you really need all A's in those science classes. Math, a lot of schools don't require calculus anymore, but a few do. So just knowing what's required, and whether you take that, again, it's the same philosophy. If you can take it in high school, go for it, because then when you take it for when it counts to get into graduate school, you'll already have had a lot of that, background, and so it'll be easier for you to get good grades.
Thank you.
Yeah.
As we close today, some of these students that are watching this may want to reach out and ask further questions. Do you have a preferred method that they would reach out to you?
Yeah, no, for sure they can reach out. We do the observations and set those up, especially during breaks and summers, that we're happy to do. We do have those pretty limited during COVID-19, but hopefully soon we will be able to open those up so they're more available when we're all done with that. And so by email is great. If you go to our website, www.exerciseabilities.org, we have a section that says get involved. And then if you drop that down, there's volunteer and observation, I think volunteer and employment. It has right in there who to connect with for setting up observations. So definitely you can contact me. My email is on there, Melanie@exerciseabilities.org, but also currently our clinical instructor that sets those up is Lisa Bailey, and her email is on the website as well.
Perfect. Well, thank you so much for taking time today. I appreciate this.
Yeah,